More people die from overdose every year in America than do from car accidents. Overdose is the #1 cause of accidental death in our country, in our state, and in our county.
To put that in perspective, that is 80 individuals dying every single day from an opiate overdose, and that is 3 people every hour.
We've been seeing overdoses involving the opiates increasing, it seems like, every year. And we really have been frustrated. Even in our response, we want to be able to do something when we get there. All of our first responders currently are trained and equipped with the Narcan.
You know, it's kind of a scary thought because we don't get nearly as much medical training as firemen or, you know, EMS, AMR, life, any of those folks. And so it is kind of a scary thought, but at the same time, it's nice to start getting some of this training so that not only if we get there first do we kind of know what to do, but so that we can help them out when they do. And so having this training and being able to work with them and learn kind of from each other is kind of nice.
So when we take opiates, they target these receptor sites in our brain, and they tell our body, to start, slowing down our breathing a little bit. These are the natural responses our bodies have from opiates. When somebody overdoses, essentially our brain is telling our body that we have enough oxygen. You don't need to breathe anymore.
And depending on the dose and the individual, because some people can metabolize the drug more rapidly than others, it may take perhaps an hour or so for a lethal level of the drug to occur in the blood and for them to stop breathing. So really what's critical is to get the naloxone into them before they stop breathing, or at least immediately thereafter, and then they can be saved.
In January 2015, Governor Snyder signed a Michigan compiled law number 28.543, eliminating liability for law enforcement using naloxone, provided that they receive training in its use and believe in good faith that the individual they're using it on is overdosing. Through watching this video, you will receive that training. You will be able to identify why law enforcement should be aware of the Naloxone Rescue Kits, explain the legality of naloxone in Michigan, identify the signs and symptoms of an opioid overdose situation, identify the steps to safely respond to an overdose, and demonstrate the use of a naloxone rescue kit.
So naloxone hydrochloride is pretty much a pure antidote for opiate overdose. It was created in the 1960s. The FDA approved it in 1971.
I started the Kalamazoo Coalition for Opioid and Heroin Awareness after my daughter died, which helped to bring about this law that would allow third parties to carry it.
In 2014, Michigan passed legislation allowing third parties to carry naloxone, joining a growing number of states that already do so. This means that in Michigan, it is legal for a community member to carry and administer this medication to another person in the community, even if they are not personally at risk for an overdose. You may come across this in the course of your duty. Law enforcement in Michigan can now also carry and administer naloxone, and are protected from potential liability if they do so.
So law enforcement, they have a job to do, okay? Heroin, abusing somebody else's prescription, is an illegal thing to do. So they've been seeing that from a criminal perspective. But underneath that is just a person who has an illness. So having them being first responders is critical. They may be there long before the ambulance service can get there. So re-educating law enforcement about who a person with an addiction is critical.
It's just another tool in our tool belt that we can use to try and help these people out. They make a poor decision. It doesn't mean that they should die from it.
So what is an opioid? Opioids are substances derived from the opium poppy, or with a chemical structure resembling it. Opioids can reduce pain and produce feelings of euphoria.
And it's not about just heroin users. It's not just about a fentanyl user. It's about mom or dad who was in a car accident and is given 2 or 3 medications plus a muscle relaxer and something to help them relax. And all of a sudden, they're not breathing at home. They didn't take too much medicine. It was just more medicine than their body could handle.
It is everywhere. And working with people, I have a lot of people say, oh, I don't know anybody who uses heroin. But if I ask them about, well, do you know somebody who has prescription drugs? They're like, oh yeah, all the time.
Yes, people are overdosing on heroin, and slightly more are starting to overdose on heroin. But the vast majority is still prescription medications.
I think it's important to know that opiates is not just heroin. It can be a multitude of opiate medications where there's Vicodin, there's Norco, there's Oxycontin, there's fentanyl, there's all kinds of opiates.
I think the biggest misconception about these patients that are using naloxone or, using large amounts of opioids is that they are drug seekers or drug abusers. And that's not always the case, or for the most part, it's not the case. You'll have those once in a while patients, but for the most part, these patients are in serious pain, and they're using these medications as prescribed to try to help that pain so that they can live their life.
Naloxone's always been historically associated with heroin overdose, right? So on the streets, people think it's for street using, but now we're trying to really educate not just the providers on that we need this naloxone, but our patients need to understand that it's not heroin, it's not overdosing from meds on the streets. It's the medications that you get. Some people can't metabolize it or get rid of the medications, and it's really about talking with our patients that this is a medication that can cause a side effect of not being able to breathe.
The prescription drug epidemic, if you want to call it that, has really led to some real changes in what we're seeing out there in the change or the assumption of what the stereotypical addict or abuser was, and the presentations that I was going to, it really showed me that it crosses all socioeconomic lines. There is no face of a person that's addicted to some of these narcotics. There really is nothing that you can define those individuals with, and so that was very eye-opening for me. I didn't know how widespread it was until I started looking into this topic.
People who are injecting heroin generally are aware of the fact that they are engaging in risky behavior. You injure your back, you go to the doctor, and your doctor gives you something to relieve that pain. You're not going home with the same mindset thinking that you might potentially be in danger. So the majority of the people in danger, the majority of the people that are really dying from an overdose are people who aren't aware of the fact that they're at risk.
One of the key things to remember is that when somebody's using an opiate, whether it's legitimately as prescribed or if it's being used illicitly, they can still overdose. So anybody who has a prescription for an opiate should have access to this life-saving medication.
And naloxone hydrochloride is a medication which was designed specifically to reverse an opioid overdose. That's its sole use in medicine. It's very, very effective, very efficient, and very, very safe.
If somebody uses too much opiate, whether that was on purpose or accidental, then this medication can be given to reverse the overdose.
One of the things that people need to understand about naloxone is that it will work on all opioids, any opioids, but only opioids.
If someone is using multiple substances, it's going to help you come out of the overdose for the opiates. It may not for the other substance, but then you're able to better evaluate the situation and see where to move from here.
If it's given to somebody who is not suffering from an opiate overdose, somebody who is not opiate dependent, it's going to essentially be like giving them water. And obviously if it is, it will save their life. So it's that safe that it's not going to hurt somebody that's not overdosing.
So we're looking at giving a medication that there is only something to be gained from.
It's clear people can and do overdose on opioids. So what puts someone at increased risk?
So some of the things that put someone at a higher risk of overdosing are mixing. When it comes to a mixed drug overdose, there's kind of two different classifications. There's when you mix an upper and a downer, so that would be like crack and heroin, or methamphetamine and prescription opioids, or any combination of those things. And then there's downers and downers, so a benzodiazepine like Xanax or Klonopin mixed with an opioid. Another risk that can increase someone's risk of an overdose is tolerance. And it's not so much having a high tolerance, but when someone's had some sort of period of abstinence, whether it was jail or rehab, or they just chose to stop using drugs for a while, and then they return to using drugs.
Don't do the same dose that I did 90 days ago, or I could potentially overdose.
Another risk that increases the likelihood of someone overdosing is the quality of whatever they're taking.
Unfortunately, heroin changes from day to day. Nobody knows what you're going to get. It doesn't come with nice little baggies with the contents, what's cut with, how much to use. And so somebody using something today could be very different from what they used the day before.
And then the last risk that we talk about with overdose is using alone. Obviously, using alone doesn't increase someone's risk of overdosing, but it can increase their risk of it being fatal.
When using, you have to have people around you. And it's a really outside the box thinking to say, if you're going to use, let people know you're using.
We've talked about overdose as a community health issue. We've talked about opioids, overdose and naloxone, and who is at risk and what puts them at risk. Now let's talk about what an overdose looks like and how to respond.
So somebody who looks like they're going to overdose or is overdosing will start to have shallow breathing. They may have blue lips.
Tiny pupils, nodding out.
So they kind of start making this snoring noise, and that's kind of one of the giveaways that they're ODing.
People will breathe slower when they're really high, but it can be hard to tell when that breathing has gotten too slow. And so really the only thing that really separates those things is whether or not that person's responsive or not.
To train law enforcement to respond to an opioid overdose situation using intranasal naloxone, we utilize the 3 A's: assess the situation, administer naloxone, and aftercare. The first step in the 3 A's is assess. We want to determine if this individual has overdosed. Certainly if you are responding to a 911 call where it has been mentioned that someone is overdosing, you probably want to arrive on the scene with your Naloxone Rescue Kit ready. You can also listen to reports of people at the scene. If someone says someone else is overdosing, or if someone has been using opioids, you may want to get your kit ready. We also just discussed the signs and symptoms that someone has overdosed. Their eyes could roll back, their lips could be turning blue or purple, pale or clammy skin, vomit, foaming at the mouth, gurgling or snoring sounds, but the 2 key points are whether or not they are unresponsive, or whether there is slow or no breathing. A good way to tell if someone is responsive or not is to do a sternal rub. A sternal rub can cause a lot of pain without causing damage to the individual. Suspected opioid use plus non-responsive and slow or no breathing equals an overdose, at which point we move on to administering naloxone. The second A is for administering naloxone. Intranasal naloxone comes in these pre-assembled nasal delivery devices. It is very easy to use and to administer. The first thing you will want to do is lie the individual on their back if they are not already. Tilt their head back slightly and gently press up on their neck. Wipe off their nose. You are now ready to administer your naloxone. Again, these devices are very simple and easy to use. Open up your cardboard box, pull out 1 blister pack, rip open the blister pack, removing the device. Grip the device with your pointer and middle fingers on either side of the nozzle and the thumb on the plunger. Really, the only way you can go wrong is by trying to prime or pressing the plunger too much prior to getting it in someone's nostril, thereby wasting the medication. Insert the nozzle fully into the individual's nostril until your fingers are touching the bottom of their nostril. Gently but firmly depress the plunger, releasing the entire contents of the device into one nostril. Naloxone takes 3 to 5 minutes to work. In that 3 to 5 minutes, the individual may not be breathing fully on their own yet. You're going to want to do whatever resuscitation technique you have been professionally taught at your agency and you feel most comfortable with. If you have been taught rescue breathing combined with chest compressions, or chest compressions only, whichever you feel the most comfortable with, you should practice on the individual until they come out of their overdose. After 5 minutes, if the individual has not come out of their overdose yet, meaning they are not yet responsive, administer your second dose of naloxone, the exact same way you did the first, except in the opposite nostril. The only reason you should deviate from administering each dose 5 minutes apart is if you suspect a fentanyl overdose. This is because fentanyl is so much stronger than other opioids. You may suspect a fentanyl overdose if someone at the scene reported this, or if you see a fentanyl patch anywhere on the individual's body. Fentanyl kills very, very quickly. So in the case of a suspected fentanyl overdose, administer both doses of your naloxone immediately, 1 in each nostril. The third A is for aftercare. After you have administered your naloxone comes aftercare. One thing law enforcement should be aware of is that administering naloxone to an opioid-dependent individual can make them experience withdrawal symptoms. This will not be pleasant for them.
Furthermore, naloxone is a short-lasting medication. It's going to wear off in 30 to 90 minutes.
Heroin can take 1 to 3 hours to have an overdose, but it'll last in your system for about 4 to 6. A lot of prescription pills are really similar, but things like methadone can be even upwards of 24 to 48 hours.
When the paramedics arrive, you should transfer their care to a person with a higher degree of medical training.
So the opiates tend to stay in the body longer, so it's really important with this medication that that person, once they get the naloxone, that they still seek emergency medical care.
There is the potential for somebody to slip back into an overdose after the naloxone wears off. More than that, the potential is with, when people use again after the naloxone's been administered, because maybe they are feeling a little bit withdrawal sick. It's really important to encourage people not to do that, because that's when the really big risk of someone slipping back into an overdose would occur. So.
Naloxone does not kick opioids out of the body. It just kicks them out of the brain's receptor sites for a limited period of time. Especially in the case of a methadone overdose, it is important that an individual is revived with naloxone and seek medical follow-up. We have now learned the 3 A's of overdose response. Assess the situation. Is there a reason to believe the individual is overdosing? Administer naloxone. If you have reason to believe it is an overdose, administer your naloxone and aftercare. Naloxone is a short-lasting medication, so transfer care of the individual when someone with a higher degree of medical training arrives on the scene. Care for the individual that has overdosed should be transferred to the paramedics or other medical personnel as soon as they arrive. When an individual with a higher degree of medical training arrives on the scene, you should transfer the individual's care to them. It's important to remain in communication with dispatch and medical personnel regarding how much naloxone you gave the individual and how they responded. Most departments also have a simple reporting process for documenting overdose reversals and uses of naloxone. Most paramedic and EMT companies can take your used kit and dispose of it for you. You now know how to save a life. It is important for law enforcement to be trained and equipped with Naloxone rescue kits, because overdose is currently a community health epidemic affecting many segments of our community. You never know when you may need to use this tool to save someone's life. In this training, we talked about why law enforcement should be equipped with Naloxone rescue kits. We talked about legal changes that protect you in your use of naloxone kits. We talked about opioids and the role of naloxone in opioid overdose situations, overdose risk and recognition, and responding to an overdose situation using the 3 A's: assess the situation, administer naloxone, and aftercare. One thing we did not talk about is community-based kits. And this is something that you should be aware of as well, because you may come across a kit in the course of duty. In the state of Michigan, there are many programs that distribute kits similar to what you got, to community members. These kits could be of the intramuscular variety, with 2 IM syringes and a vial of naloxone. They could be auto-injectors, or they could be exactly what you've got here today. You may come across individuals carrying these kits, or you may even come across individuals administering naloxone to another community member from one of these kits. Both of these situations are legal in the state of Michigan. It is legal for anyone to be prescribed a naloxone kit, and it is legal for naloxone to be administered to anyone else in the community. Overdose is a community health issue, and it will not be successfully addressed without the community response. We appreciate your taking the time out of your day to get trained on how to prevent and respond to an opioid overdose situation. And we appreciate your taking these kits out into the community to save lives.